and Telugu followers అందరికి hi, myself RJ Joe, and right now నాతో ఉన్నారు డాక్టర్ నీరజ్ యనమండ్ర గారు, కన్సల్టెంట్ obstetrician and gynecologist. అలాగే he's also specializes కాంప్లికేటెడ్ ప్రెగ్నెన్సీస్ అన్నమాట, అంటే హై రిస్క్ ప్రెగ్నెన్సీస్ అని చూస్తారు. అలాగే లాప్రోస్కోపీ అండ్ హిస్టరోస్కోపీ సర్జన్. సార్, చాలా పెద్ద లిస్ట్ ఉంది మీది. హాయ్ సార్, హౌ ఆర్ యూ?
Yeah, sure. Thank you, Joe. List it better because we kind of that's the areas where I specialize in. That's where we have worked hard to achieve those skills.
Sir, my first question, I want to know, how are you managing with too many things? I know it's difficult.
Yeah, but this is what I always wanted to do. This is where I had actually worked up my whole profile. Okay. So this is where actually I'm enjoying my work now.
You're enjoying. Lovely. Sir, and what are gynaec endoscopic surgeries, sir?
Now, gynaec endoscopic surgery, or any endoscopic surgery, when we say, essentially what it means is we are trying to do surgeries through small keyhole methods, which means in the past we used to have big long cuts on the body to do any surgeries. These days with endoscopic procedures, we are doing the same surgeries through smaller incisions on your skin, so smaller cuts on your skin. So cosmetically it's very good, and it also has other advantages. So endoscopic surgery broadly means that you're doing surgery through minimal access route, which means it doesn't involve long cuts on your skin. And in gynecology especially, it includes laparoscopy and hysteroscopy.
Okay.
So laparoscopy essentially means putting a camera through your belly button or your tummy somewhere and having a look inside to look at the internal organs. Whereas hysteroscopy means putting a camera inside the woman's womb, uterus, to identify if everything is normal or there is a problem.
What are the advantages over traditional surgeries, sir?
Traditional surgeries, when we say, they used to involve big cuts on your tummy, as I said earlier. With these methods, you have smaller cuts on your skin, so cosmetically it's very, very good. No one wants to have big scars on the skin. And the other important things which makes it unique or different from traditional methods is there is far less blood loss during surgery when we do surgeries by this way. It also causes less pain. It also helps women recover early and quickly compared to the longer incision or old traditional surgeries. And most women who are working women, they can get back to work. Either it is their work as such, or it's domestic work, housework, social work, everything, the recovery is very fast. So essentially, to summarize the benefits, it is cosmetically very good. It causes less blood loss, less pain, and need for less pain relieving medicines, and also at the same time quicker recovery and back to work. So these are the advantages which this surgery offers.
Okay. And what advanced gynecological laparoscopic procedures do you do, sir?
Now, the laparoscopic surgeries, these have actually picked up in India in the last, I would say, 2 to 3 decades. The primary difficult ones which we do are the total laparoscopic hysterectomy, which means removal of the uterus, and that can be done through laparoscopic surgery. And uteruses which have large fibroids, for example, or women who have had previous cesarean sections, those surgeries can particularly be very complicated, and that we do laparoscopically by minimal access route. Similarly, we do large fibroids or large adnexal ovarian masses. You must have heard ovaries, which women have, and if there are large cysts or tumors in those ovaries, we do manage those cysts as well. And one of the advanced procedures which we do is, there are women who may need laparoscopic surgery or any gynecological surgery while they are pregnant. So in early pregnancy, for example, 2, 3, 4 months of pregnancy, or even up to 5 months of pregnancy, if they have any complicated gynecological problem, then we can do the surgeries laparoscopically with minimal harm, in fact, no harm to the pregnancy. So these are quite advanced procedures which we do in our hospital.
Okay. And does laparoscopic and hysteroscopic surgeries have any role in infertility, sir?
That's actually a very good question. In fact, laparoscopy or hysteroscopic surgery complements infertility procedures very well, because there are lots of problems in infertility where women are unable to conceive, the couple are unable to achieve pregnancy. And to name a few of these conditions, one of them which we are more often these days seeing is tubal block, which means 2 tubes which women have. If they are blocked, then that woman is never going to get pregnant. And by laparoscopy and hysteroscopic method, we are able to open the tubes almost in 80 to 90% of women. So once we open the tube, they can get pregnant very easily. So that's one of the commonest things. There are other conditions like fibroids in the cavity of the uterus, for example, wherein these are small little lumps in the uterine cavity, in the cavity of the womb, and if it is there, it distorts the whole anatomy of the cavity, which means the way the cavity should be, as nature has given, it is disturbed, and pregnancy cannot happen. So removing those fibroids can help women get pregnant. So that's another condition. Then there is a very common condition you might have heard, PCO, polycystic ovary. Women who have polycystic ovaries, those women do have difficulty in conceiving or getting pregnant. There are medical methods, which means avoiding surgery. There are medical ways of trying to see if the woman gets pregnant. But if pregnancy doesn't happen with medical methods, then we have to resort to surgical technique, wherein by laparoscopic method we do certain maneuvers and techniques, wherein we help women get pregnant in polycystic ovaries as well. And similarly, if women had any past infection in the pelvis, then there can be adhesions, which means there can be bands of fibrous tissue, which can also cause infertility. So there are these different conditions which we can identify and treat in the same setting, either by laparoscopy or hysteroscopy, or by both in many occasions. So yes, laparoscopy and hysteroscopy together, that is endoscopic surgery, has a big way and big role to play in helping couples with infertility.
Does laparoscopic surgeries have a role to avoid abortion, sir?
Actually, that's a question which needs to be addressed, because women who have pregnancy losses earlier in pregnancy, say first 2 to 3 months of pregnancy, their endoscopic surgery, laparoscopy doesn't have a significant role. But once women cross, say, 14 weeks of pregnancy, which is around 3.5 to 4 months onwards, and those women who have extreme preterm births, we say, which means if they deliver between 24, 26 weeks, or even before that, so even between, say, 14 to 24 weeks of pregnancy, if they recurrently abort, meaning if they deliver the pregnancy at such a small period of pregnancy, then almost always the defect is in the cervix. That's the entrance of the uterus from the vagina. So once you have that weakness in the cervix, then most doctors would have done a stitch which is put on the cervix from below. But women who don't respond to that kind of technique, or women who have very short cervix, laparoscopic surgery has a significant role. In fact, we've done a lot of we have achieved a lot of pregnancies, successful pregnancies, by doing laparoscopic cervical cerclage, meaning by laparoscopy, we do put a tape, a stitch around the cervix from above instead of going from below. So that has a very high success rate. In fact, in our experience, the success rate is almost as high as 90 to 100% once the woman crosses fourth month of pregnancy. So yes, endoscopic surgery, especially laparoscopic surgery, has a significant role in avoiding abortions. I'm specifically talking about abortions which happen after third month of pregnancy. These stitches can either be put when the best time to put these stitches, according to me, is when they're not pregnant. Before achieving pregnancy, we do the stitch. After that, the woman can plan pregnancy, and then the chances of pregnancy success is very high. But there are women who get referred to us by different places outside state as well, who do come while they are pregnant already. So in those women, the surgery becomes a little more challenging, but we do those surgeries where we put the tape around the cervix laparoscopically during pregnancy, and that gives a good success rate and a good chance of couple actually having and carrying the baby home.
Thank you, sir. Thank you so much. And one final word for all the Red FM viewers.
As a gynecological endoscopic surgeon, I would say that most gynecological surgeries, if not all, can be performed by minimal access route, that is laparoscopy or hysteroscopy, with small cuts on your skin, and with all the other advantages which I have just said. So all you need to do is find the right hospital, find the right doctor, and see if you can get rid of your problem or address the problem by minimal access route. By minimal access, I mean by laparoscopy and hysteroscopic surgery, and avoid getting larger skin incisions, longer recovery, and more blood loss, which happens with traditional open methods, as compared to laparoscopic surgery, which, as I said, amongst the advantages is quicker recovery, less pain, less blood loss, and also cosmetically it's very good.
Thank you, sir. Thank you so much. Nice talking to you.
Thank you, Joe. Thanks. Nice talking to you.
Yes, sir. Bye-bye. So yeah, that was Dr. Niraj sir from Hydernagar branch, Rainbow Hospital. So yeah, keep following Red FM Telugu page for more videos. Stay tuned. Bye bye. అయిపోతారు సౌండ్ కే